Hi, teacher. How's it going? My name is Rishi Anden, and now I'm gonna read from chapter 4 to 12. Let's begin. Medical practitioner. Practitioner in Brighton, doctor, also known as a medical practitioner, must be qualified to have a university degree in medicine. They must also be registered, including the Junior Medical Council's list or registered in order to practice. A doctor who treats patients as opposite to one who only does research is called a clinician. A doctor who provides primary care for patient is known as general practitioner or GP or family doctor. GPs or general practitioners usually work in a group practice, large group practice work in a building called a health center. Uh, Point B, specialist doctor, for example, pediatricians generally work in hospitals. However, those who work outside the NHS, I think is National Health, I remember, providing private health care may have consulting rooms outside a hospital, for example, in the famous Harley Street in London. The two main branch of medicine are surgery and internal medicine. As a doctor who practice this branch are called surgeon or physicians, respectively. In Britain, male surgeons are addressed as Mr. or female as Miss. So Dr. Smith is a physician and Miss Smith is a surgeon. For example, a cardiologist specializes in disease of heart, of the heart and circulation or cardiology. A pediatrician is a specialist or is a specialist in disease of elderly patient or pediatrics. And anesthetic is a specialist in anesthetic or specialized in anesthetic. Point C, choosing a specialty. Jill Matthew had just graduated from medical school and he's talking about her future. And he said, I haven't decided what specialty I need. I need more experience before I decide, but I'm quite attracted to the idea of pediatrics because I like working with children. I thirdly prefer to work with children than, say, elderly patients, so I don't fancy pediatrics. I was never very interested in deteriorate anatomy to the surgical specialty like neurosurgery don't really appeal. You have to be good with your hand, which I don't think is a problem for me. I've assisted at operations several times and I've even done some minor ups by myself. But surgeons have to be able to do the same thing again and again without getting bored, like trying off guard arteries and so on. I don't think what would be a problem for me, but they need to make decisions fast, and I'm not good at that. I like to have time to think, which means surgery is probably not right for me. But let me translate this part. Dame para arriba, ¿ok? Medical practitioner. Entonces, es como los médicos practicantes. Dice que en Gran Bretaña los médicos también conocidos como physicians, o médicos deben estar calificados, o sea, tener un título universitario en medicina. También deben estar registrados, incluido en la lista o un registro médico general que hay para poder ejercer. Entonces, un médico que trata a pacientes, a diferencia de uno que solo investiga, se llama clinician. Un médico que brinda atención primaria a los pacientes se conoce como médico general o GP, General Practitioner, un médico de familia. Entonces los médicos cabeceras suelen trabajar en una práctica grupal. Entonces los consultorios de grupo más grande trabajan en edificios llamados Health Center. Entonces, specialty, los médicos especialistas, por ejemplo, los pediatras, trabajan generalmente en los hospitales. Sin embargo, quienes trabajan fuera del Servicio Nacional de Salud, NHS, y ofrecen atención sanitaria privada, pueden disponer de consultorios fuera de un hospital, por ejemplo, la famosa Harley Street en London, donde hay muchos consultorios de médicos. Entonces, las dos ramas principales de la medicina son cirugía y medicina interna, y los médicos quienes practican esas ramas se denominan cirujanos o doctores, surgeon of physicians. Respectivamente, en Gran Bretaña, a los cirujanos varones se les llama señor y a las mujeres señoras, por lo que el doctor Smith es médico y la señora Smith es cirujana. Entonces, aquí nos da unos ejemplos de cardiólogo, geriatra y anestesistas, que son personas que se especializan, por ejemplo, de cardiología, de la enfermedad del corazón y de la circulación cardíaca, y se le llama cardiólogo. También está el geriatra, enfermedad del paciente anciano, y el anestesista que se encarga de dar las anestesias. Donde dice punto bis, choosing specialty, eh, Jill Matthew acaba de graduarse de la Facultad de Medicina y está hablando de su futuro. Se dice que aún no sabe o no se ha decidido en qué especializarse. Necesita más experiencia antes de decidirme, dice ella. Pero me atrae bastante la idea de la pediatría porque me gusta trabajar con niños. Ciertamente, dice ella, prefiero trabajar con niños que digamos con paciente anciano. Así que no me gusta la geriatría. Nunca estuve muy interesado en la anatomía detallada, por lo que las especialidades quirúrgicas como la neurocirugía realmente es como que no le gusta o no le atrae. Tiene que ser muy bueno con la mano, lo cual creo que es un problema para mí. Dice ella que ha asistido en varias cirugías e incluso ha hecho algunas operaciones menores, ella sola. Pero los ciudadanos tienen que ser capaces de hacerlo, o sea, de hacer lo mismo una y otra vez sin aburrirse, como atar arterias cortadas, etcétera. Se dice ya que no creo que eso sea un problema para mí, pero necesitan tomar decisiones rápidas. Yo no soy muy bueno en eso. Me gusta tener tiempo para pensar, lo que significa que la cirugía probablemente no sea lo de ella. As a right sentence to describe the work of specialists in each branch of medicine. Look at the opposite to help you. Dermatology, a dermatologist specializes in disease of the skin. A rheumatology specializes or is a specialist in disease of their of their joints. Rheumatology traumatology, so specialized in accident and emergency medicine. A pediatrics is specialized in disease affecting children. Obstetrics is a specialist in managing pregnancies. Complete the table with word from A to B, rely from, put a stress mark in front of the stress syllable in each word. First one has been done for you. Specialize, specialist, specialty, practice, practitioner, practice, a consultant, consultation, assistant, graduate, graduation, and qualified, qualification. Those defined preposition in C opposite that be used in mark word combination with the word in the box. The use the correct form the word to complete the sentence. Good interest specialized in work. First one is a pathologist specialized in diagnosis disease through examination cells and tissue. Pediatricians must enjoy working with children, and oncology is interested in the diagnosis and treatment of cancer. A physiatrist must be good at counseling, and a surgeon must be good with fair hand. Thus, the make word combination using a word form each box. Two words can be used twice. Okay, look at B. Okay, look at B from B, A, B, and C opposite to help you. Consulting, back on rooms, general practitioner, group, practice health center, general medicine. Entonces vamos a ir a la segunda parte que es Medical Practitioner 2. Entonces, hospital staff. The people who work in any type of workplace, including hospital, are called staff. The medical staff in British hospital belong to one of four main groups. First one is a previous station house officer, PRHO, or house officer. Is a newly graduated doctor in the first year of postgraduate training. After a year, he or she becomes a registered medical practitioner. In the current system of training, the foundation program, the name for these junior doctors is foundation years, one doctor of a FY1. Entonces, second one is a senior house officer of SHO. Is in the second years of postgraduate training. The title is now foundation years to doctor of FY2, but the old term senior house officer and SHO are still used. A third one is specialist register. Se me hace rara esa palabra. SPR is a doctor who completed the foundation program and training is one of the medical specialties. There are also some non-training registrars, doctors who have completed the training but do not wish to specialize yet. First one is a consultant, is a fully qualified specialist. There may be some associated specialists, senior doctor who do not wish to become consultant. In addition, there is at least one medical clinical director who's responsible for all the medical staff. Don't say medical team. Consultant physicians or surgeons are responsible for a specific number of patients in the hospital. Each consultant has a team of junior doctors to help care for this patient. In many hospitals, there are multidisciplinary teams which consist not only of doctor but also of physiotherapists and other allied health professionals. When patient enter a or are admitted to hospital, they are usually sent first by one of the junior doctor or the where they will receive treatment and care. The junior doctor collects them, take their medical history, and examine them. Sometime later, the registrar also see the patients and may order investigation or tests, for example, X-rays or a ECG, a microvision diagnosis, or begin treatment. The consultant usually sees the new admissions, people who have recently been admitted to the ward for the first time on one of the regular rounds. Uh, when the measurement of the patient is discussed with the registrar, consultant also decide when a patient is ready to be discharged to see home or the ward room. The consultant is accompanied by their team and nurse and they visit the patient and consultant care. Entonces, punto C is shift. Junior doctor would normally work in a shift with shift. I don't know how to pronounce shift. I think shift, which means they normally work an 8 hour every day. For example, from 8 a.m. to 3 p.m. and are then free until 7 a.m. the next day. After a week, they change a different shift. For example, 3 p.m. from 11 p.m. or from p.m. to 7 p.m. The alternative system to work from 9 and 7 p.m. every day and to take turn to be a call available to return to the hospital if necessary from 5 p.m. to 9 p.m. and the next day. Days on call are set out in the rota of these delays of time. Doctors can carry a radio pager or bleeper device which make a noise when someone is trying to contact them. But let me translate this part que habla como de hospital staff, como el personal del hospital. Se denomina personal es como a las personas que trabajan en cualquier tipo de lugar de trabajo, incluidos los hospitales. Entonces, el personal médico de un hospital británico pertenece a uno de los cuatro grupos. Primero es un oficial interno o preinscrito, PRHO, o funcionario interno, que es un médico recién graduado en primer año de formación de posgrado. Entonces, después de un año se convierte en médico registrado. Entonces, el segundo es Senior House Officer, SHO, que es como un funcionario interno superior que se encuentra en un segundo año de formación de posgrado, se titula ahora médico del segundo año de la fundación. Entonces, pero los antiguos términos oficiales superiores de la casa es SHO. Entonces, un Specialist Registrar, que es como un médico que ha completado el programa básico y está en entrenamiento en una de las especialidades médicas. También algunos registradores de información, médicos que hayan completado información, pero que aún no desean especializarse. Entonces, a consultan es como el que ya está calificado totalmente, que también puede haber algunas realidades asociadas, médicos veteranos que no desean convertirse en consultores. Además, existe al menos un director clínico que es responsable de todo el personal médico. Entonces, a medical team que es como el grupo médico. Los médicos cirujanos, consultores, son responsables de un número específico de pacientes en el hospital. Cada consultor tiene un equipo de médicos jóvenes que ayudan a cuidar a los pacientes. Un junior, let me see, yes, number, patient, many experience, doctor. Okay, sorry. Entonces, formado por médicos, sino también por fisioterapeutas y otros pacientes de la salud, aliados al aire. Cuando los pacientes ingresan recientemente al hospital, generalmente son atendidos primero por uno de los médicos jóvenes de la sala donde recibirán tratamiento y atención. Entonces, el médico junior los atiende, toma su historial médico, los examina. A un tiempo después, el registrador también atiende al paciente y puede ordenar el examen más específico, pruebas, por ejemplo, la radiografía o el electrocardiograma, hacer un diagnóstico provisional o comenzar el tratamiento. Los consultores generalmente ve a las nuevas admisiones, personas que recientemente han sido admitidas en la sala por primera vez, una de las rondas regulares de sala, cuando la gestión de pacientes se discuten con el registrador. Los consultores también deciden, como que deciden cuando un paciente está listo para ser dado de alta, etcétera. En la visita, el consultor está acompañado por el equipo y una enfermera, invitando al paciente bajo cuidado, consultants care. Entonces, turnos es como que los juniors doctor, los médicos jóvenes ahora totalmente, normalmente, por turnos, lo que significa que normalmente trabajan 8 horas al día, por ejemplo, de 7 de la mañana hasta las 3 de la tarde, y luego están libres hasta las 7 de la mañana del día siguiente, después de la semana cambian, van como rotando esas formas y esas maneras. Déjame quitar esa llamada. Entonces, el sistema alternativo, entonces después de una semana cambian el turno y así. El sistema alternativo es trabajar de 9 a 5 todos los días y como tomar y estar de guardia, disponible para regresar al hospital si es necesario. Entonces, los días de guardia se establecen una lista de nombres y horarios. Los médicos de guardia llevan un busca persona o un radio pager o bleeper, pager, que admite ruido cuando intenta comunicarse con ellos. Ok. So la segunda parte, make word combination using a word from each box. Look at A, B, C opposite to help you. Associate specialist, house officer, on call, provisional diagnosis, radio round, a round, radio, pager, round. Entonces, match to description, okay, one, el one va con, el one va con consultant, el 2 va con la D, 3 va con la A, 4 va con la E y 5 va con la B. Ok. Are you following statement true or false? Medical graduate becomes registered 2 years after graduation is false. The system of training doctors breeding scholar the foundation program is true. The name senior house officer is no longer used in branding is false. Consultant is usually the first doctor to see an patient is false because already the word a lot of junior doctor. When working in shift, doctor take turn to be a call. It's false. Complete the text to PRAHO describing the job. So when I get the word, the first thing I do is talk to the house officer was in duty during the last shift to find out if there have been any new admission. Then I generally see the charge nurse and he tell me if there isn't anything we need to done currently, such I intravenous I to take down later in the morning clerk any new patient, which basically we're taking a history. On Tuesday and Friday morning, the consultant does her ward round, and I had to make sure I'm completely updated of her patient. After that, there usually lots of things to do, like writing a request form for blood test and so on. In the afternoon, I have to prepare for any patient who are to be discharged the next day. They're usually happy. They're usually happy to be going home. And then, of course, there are lecture tutorials of training foundation program on Monday and Wednesday. Entonces, vamos a hablar ahora de nurses, las enfermeras. Nursing grades. Nursing work in a hospital have the following grades. Student nurse is a nurse who is self-training. Staff nurse, a nurse who has completed training course. Charge nurse, a nurse experienced nurse who has charge of responsible for a ward of department. For nurse manager, a nurse who is charge of several ward. Entonces, support worker, the clinical support worker who has done a short course to obtain basic qualification under nursing auxiliary, who is usually unqualified, but assist nursing staff. There are many also toward clerics whose duty include making sure patients' notes and information are up to date and answering the telephone. Specialization like doctors, nurse can specialize. First one is a midwife, a specialized from the beginning by doing a course of midwifery, in managing pregnancy and childbirth. Second one is district nurses visit patient in their homes. And third one is her visitor, also work of the community, giving advice to the promotion of health and the prevention of illness, prevention de enfermedades. Entonces, role, the nurse roles are charged considerably is recent year. In addition to general patient care, checking a temperature, let me temperature, pulse rate and blood pressure, changing dressing, giving injection, and removing suture. Nursing now do some of things previously reserved for doctors, such as prescribing drugs and ordering laboratory tests. More responsibility for nurses is planning of, as the following article demonstrated. Nurses carry out surgery, therefore could patient waiting less. Nurse in Scotland training to perform minor surgery after the operating third for the first time in an effort to cut patient waiting time. Five nurses who have passed a new course of Glasgow Caledonian University are not qualified to carry out such procedures as the removal of small lesions, meaning mole cyst, kyste. Those the verb perform and carry out are used with all type of procedure. They're often used in basic form. Perform an examination, operation, carry out a procedure, an experiment, a test, and biopsy. Procedure was performed by a nurse. Procedure was carried out by a nurse. But let me decir esta parte, como las enfermeras. Entonces, las enfermeras trabajan en hospital, siguen o tienen los siguientes grados. Puede ser enfermeras que son estudiantes todavía, que son todavía que aún están en prácticas, las enfermeras que son más o menos de cargo, las enfermeras que completaron ya la práctica. Las enfermeras completas son como las enfermeras que ya tienen experiencia, o sea, ya terminaron todas las prácticas, son responsables de un departamento o algo. Entonces, no es manager como los enfermeras que están al cargo de varias salas. Entonces, en support worker como los trabajadores de apoyo. Entonces, el trabajador de ayuda clínico que ha realizado un corto curso y obtenido conocimiento prácticamente básico acerca de calificaciones del auxiliar de enfermería, generalmente no está calificado. Ayudan al personal de enfermería, también pueden haber empleados de salas, cuyas funciones incluyen como asegurarse de que las ropas de los pacientes, informaciones están al día y todo lo que tenga que ver como con el teléfono answering the telephone. So, specialization. Entonces, como doctores, eh, es como que las enfermeras pueden especializarte en midwife como la matrona, como que se especializa desde el principio realizando cursos de matrona y manejo de embarazo y parto. District nurses es como las enfermeras distritales que como que tienen su propio paciente y lo visitan desde su casa. Health visitor es como los visitores sanitarios que también trabajan en las comunidades dando consejos, promociones de cómo el cuidado y prevención de salud. Entonces, el papel del enfermero o de la enfermera eh, ha cambiado considerablemente en los últimos años. Además, el paciente general, eh, o sea, su cuidado era como controlar la temperatura, el pulso, la presión arterial, enviar vendaje, etcétera, vendaje, etcétera, inyecciones. Sin embargo, esto ha cambiado, ya que esto era reservado solamente para los médicos, pero ya no, porque pueden ahora, such as prescribing drugs, pueden dar recetas de medicamentos, literatura de laboratorio. Más responsabilidades por esta previsto aumento en las enfermeras, como demuestra el siguiente artículo. O sea, va a haber más cargo para las enfermeras. Entonces, las enfermeras realizan cirugía para reducir las listas de espera de los pacientes. Entonces, los verbos perform y carry out se utilizan en todo tipo de procedimientos. A menudo se utilizan en forma pasiva, como es como carry out, es llevar a cabo un test, un procedimiento. Entonces, the procedure was performed by a nurse o was carried out by a nurse, como ha sido realizado por la enfermera. El procedimiento fue realizado por la enfermera, fue llevado a cabo por la enfermera, etcétera. Entonces, y nos habla, complete the sentence, look at A, B, and C opposite to help you. Someone who specializes is delivering babies is a midwife. Someone who are qualified as his nurse is a clinical support worker. Someone who are not qualified but is able to assist nurses como nursing auxiliary. A nurse who are qualified is a staff nurse. A nurse who specializes in health promotion is a health visitor. Nurse who looks after the ward is a charge nurse. A nurse who works in the community is a district nurse. Someone who answers the ward telephone is ward clerk, como la enfermera de sala. Make a combination using our phrase from each box. Look at the procedure to help you. Carry out the procedure, change dressing, check temperature, give injection, remove suture. Complete the sentence with the correct grammatical form to perform. Inside the brain scan painless is easy to perform. Biopsies the pancreas was performed last March. If the patient's condition deteriorate is a laparotomy should be performed. If a diagnosis of meningitis is suspected, a lumbar puncture must be performed. Last year, we performed a randomized double-blind group study. A computer sentence with the core grammatical form carry out. I now intend to carry out a larger study. Furthermore, fewer properly controlled trials have been carried out so far. A number of studies have been carried out recently to look at discretion. A right hemicolectomy was carried out and the patient made a full recovery. The procedure can be carried out in the emergency department. Vamos con allied health professionals, como los aliados. Ay, I'm so tired de la profesional. Entonces, community health. The health of the community depends on a large number of people, other than medical practitioner and nurse. This can be grouped under the heading of allied health professional, including the following. First one is physiotherapists, help people to remove by getting them to exercise or treating their body with head and massage treatment for manipulating muscles and joint with the hand. Occupational therapists are people with disability to perform tasks and work disability is a physical and mental condition that make it difficult to live normally. For example, blindness or deafness. Social worker help people to solve their social problem. For example, poor housing or unemployment or family problem. Therapists also know podiatrists treat condition affecting the fit. Technician, there are numerous technicians, people who work with scientific equipment, such as radiographer who are now X-ray technician, ambulance technician working in the emergency medicine service, and ambulance technician with more advanced qualification is called a paramedic. Prosthetic or orderist. Prosthetic orderlists provide care for anyone who needs artificial limbs or prosthetic or way to support and control part of the body, and already sterile advice rehabilitation, helping patients return to normal life and work after treatment. Study provide artificial replacement for patients who have an amputation or be born without a limb. Others provide a range of splints and other device to aid in movement, correct deformity from abnormal development for the body, for example, club foot and relieve pain. Optician tests ASI and prescribed glasses, also known as spectacles and contact lens when necessary. Examination including measuring intraocular pressure, the pressure fluid inside the eye, and examination in retina. If the patient suspect an eye disease such as glaucoma, they refer the patient to the GP or general practitioner for treatment. The general practitioner may then refer the patient to an ophthalmologist, a doctor specialist of the eye. Translate this part. Eye. It's like allied health como el aliado de la salud. Entonces, la salud en la comunidad depende de un número de personas, además de los médicos, enfermeras y esto. Pueden agrupar bajo el título profesionales de la salud aliados, incluyendo los siguientes: los fisioterapistas, que son como ayudan a la persona a moverse haciéndole hacer ejercicio, tal el cuerpo con calor, con masaje, como para ayudar de los músculos, articulaciones o las manos. Entonces está el terapeuta ocupacional, que es como que ayuda a las personas con discapacidad a realizar tareas del hogar en el trabajo. Está también el social worker, el trabajador social, que ayuda a las personas a resolver los problemas sociales, por ejemplo, la miseria, la pobreza, el desempleo, problemas familiares. Y está el chiropractor, es como el podólogo, también conocido como podólogo, que es de las afecciones de los pies. Están los técnicos en los hospitales. Sé que hay numerosos técnicos, personas que trabajan con equipos médicos, tales como el radiografista, conocido como técnico de rayo X, los técnicos de ambulancia que trabajan en servicio de medicina de emergencia. Técnico de ambulancia cuenta con la calificación avanzada y cuando cuenta con la calificación avanzada se llama o sea, los llaman paramédicos. Entonces, el protetista, el protecista o el ortesista será. Como que hay números técnicos, personas que trabajan en equipos científicos, como los radiólogos, conocidos como técnicos de rayo X, eh, como que los ortetistas brindan atención a cualquier persona que necesita miembro artificial, ya que con dispositivo para sostener o controlar esa parte del cuerpo. También asesoran sobre la rehabilitación, ayudan a los pacientes como a volver a la normalidad, y trabajan después del tratamiento y así. Entonces, los, op- es como aquí lo decimos, el optómetra, que es como que es el que evalúa, examina la vista y prescribe las gafas, también conocida como spectacle, o los lentes de contacto, es necesario. Ellos hacen el examen, incluyendo medir la presión intraocular, la presión del líquido del ojo, examinar la retina, pero si en caso de que ellos llegan a sospechar que hay algo fuera de normal, ellos te recomiendan a tu GP o General Practitioner, que es como tu médico cabecera, y ese médico cabecera, si ve que hay una enfermedad, te puede referir ahora hacia un oftalmólogo, que es el médico especialista en enfermedad de la vista. Entonces, make word combination using a word from each box. Ambulance, back on professional. Artificial, back on limb, club, back on food, contact, back on lens, health, health professional, intraocular pressure, occupation therapist, and social worker. Which allied professional could best help the following people? But first one is a young married woman who has just had a baby, is a social worker. A man who was having difficulty using her right hand following fracture is a physiotherapist. Someone who needs glasses, a optician, que se encarga de eso. An elderly woman who who has a biliary amputation, prosthetic, occupational therapist. A man whose wife has determined this is a social worker. A man with fungal infection is fit, psoriasis o quirópolis. Entonces, el punto O.3, 8.3. A prosthetic works with patient for her age and member a clinical team. A base lodged to hospital, the patient may need a prosthetic or surgery accident for amputation following a disease such as diabetes. Typically may have been born without limb. Orally is therapies to give people under care for possible rehabilitation. The main aim is to enable this patient to lead normal for leisure. Entonces, they deal with people for their age. For instance, children who have cerebral palsy may require splints to help them work to many other people and need special shoes to correct deformity or deformities. Is damage. Any part of human skeleton may require some of arteries. The arteries may be needed reposition to body to relieve pain. La parte 9 que es como del hospital, introduction to a hospital. Entonces, Jordi Pons is a 4 years medical student from Barcelona. He has come to Britain in an elective attachment to the rare infirmary in Diburth, como una ciudad. Baron introducing him to the hospital. Entonces, Dr. Baron, the infirmary is the name of the university hospital for Edinburgh University. It's the general hospital dealing with all type of patient and illness except pediatric. We have a specialty hospital for that in another part of the Edinburgh. The hospital for sick children, you can also some of the department of the hospital on the sign. Of course, there are many other, for example, intensive care unit, ICU, and the surgical high dependency unit, HDU. Jordi, what does our patient mean? It's about our patient are the people who come to the hospital to attend a clinic or to have tests or treatment and then return to the on the same day. The patients stay in the hospital for one or more day. The rooms where they stay are scarlet wards. If the patient treatment required only one day, such as a simple operation, they can be admitted to the day surgery. So welcome to our infirmary. Serve intense card CD visitor staff, the symptom center, the palliative health, including gynecology emergency, maternity emergency, meteorology emergency. In our patient department, all work like the surgery unit, endoscopy, X-ray department, and combined assessment. So outpatient, Dr. Barron explained us. The accident and emergency department is called casualty is where patients were actually ill with a certain serious condition come for assessment and treatment. Outpatient who have a appointment to see a specialty to clinic is one of their patient department or PDS. They have usually been referred to the hospital by their GP or practitioner who has write a further letter to consult explain the patient problem. In patient, Dr. Barron explained us the patient